We are coming together today with the county and with our partners at Atrium Health Wake Forest Baptist to really share a very strong message. And that is, we're not asking you to get vaccinated. We're not telling you to get vaccinated. We're really begging you to get vaccinated. We've been at this for over 2 years. You know, our healthcare workers, they're tired. While the community has certainly rendered a lot of support to what we call, to these frontline heroes, they don't really want to be heroes anymore. They want to go back to being moms and dads, brothers and sisters. They get tired. They also get sick. So it is not too late to get vaccinated. It's not too late to get boosted. That is to help bring down the community spread and hospitalizations. And just a few comments about hospitalizations. We are currently at about 90% capacity across our system. Some of our facilities are higher than that at 98, 99% capacity. We currently have over 500 patients hospitalized with COVID across our system. Of those, 80% are unvaccinated. If you break that down a little bit further, and you add to that what we would refer to as under-vaccinated, so folks who have not yet completed a series or have not been boosted, that raises that number up to about 96%. So 96% of our patients who are hospitalized now with COVID are either unvaccinated or under-vaccinated. So looking at it a little bit differently, for patients who have been completely vaccinated through the series to include the booster, that only represents 2% of our patients that are hospitalized with COVID. So when you ask me, do vaccines and boosters work? Yes, they work. They work to keep you out of the hospital. They work to keep you alive, and they work to help us all get back to normal.
Everybody is extremely busy. Our EMS system here in Forsyth County, we typically from year to year see about a 3% or so increase in calls. That's natural population growth. That's what we expect. From 2020 to 2021, as we finished out the calendar year of 2021, we saw an 11% increase from right at 47,000 calls a year to 52,600 calls a year. So that's a significant increase for us. Our staffing, it's no surprise. Our staffing is like everywhere else. There's a nursing shortage. There's a paramedic shortage. We've got multiple positions open. Some of that we can blame on COVID in ways you wouldn't think of. Our education system was down for a while during the COVID shutdown. So that really, put a halt to a lot of training. So there's a lot of reasons for it, but our calls in general are up. Our COVID calls are up. The acuity of calls that we are running on a daily basis is incredible. It really is. And this is not just COVID. I mean, the car wrecks, the violence, what we don't realize a lot of times is all the other stuff hasn't stopped. People still have heart attacks. They still have strokes. The opioid epidemic is just as bad as it was pre-COVID. I mean, we run those calls on a daily basis as well. And we get, so our people are inundated all the time with calls. The congestion that the emergency departments see, unfortunately, we add to that, of course. But at the same time, that congestion causes us problems. It increases our turnaround time, and there's a trickle-down effect to everything. So if the emergency room is busy, it takes longer to turn over patients. If it takes longer to turn over patients, ultimately it affects our response time. So when you call 911, it's going to take us longer to get there. Our trucks are not in the districts. They're running call after call after call. I think Dr. Old touched on something very important. He talked about the wait times and such in emergency departments. There's a myth in our community that, well, I can't get into the emergency room, so I'll just call an ambulance. They'll get me right back. If there's anything I can do today to dispel that myth, that would be the number one thing, because I promise you, we do not bypass triage at either hospital. Depending on your complaint, just like when you walk in the door at the hospital, is what's going to happen. If you are non-acute, we're going to drop you off at the same triage that you would if you walked in the front door. And you're going to sit in the waiting room and wait just like you would if you walked in the front door. So how you arrive has absolutely nothing to do with how fast you get treated, how you get treated. And as was mentioned, it doesn't change our level of care. It doesn't change what we're going to do for anybody. We're going to treat each patient appropriately and what is needed.